Thank you for joining us for North Metro TV News. I'm Ben Hale.
And I'm Danica Peterson.
A little-known governmental body has garnered much attention in the last few weeks, putting the race for the North Suburban Hospital District front and center.
An election, a decision to dissolve, a lawsuit, and a plan to change the healthcare landscape in the North Metro are at the center of this debate. It is not an easy debate to understand, since most voters have never heard of the North Suburban Hospital District. Ben has more on the future of the hospital district and those who are trying to change its course.
There are many layers to the debate surrounding the future of Unity Hospital in Fridley and the North Suburban Hospital District. Unity Hospital has been serving the community for 50 years and was originally established by the North Suburban Hospital District. Taxes on area communities were levied and the hospital was built. Unity for decades has been operated by a nonprofit healthcare organization, currently Allina Health. Allina leases the buildings and the land from the hospital district and is responsible for the complete day-to-day operation of the hospital. When Allina announced earlier this year a plan to combine Mercy and Unity hospitals into one hospital with 2 campuses, the hospital district board started having discussions about the impact of that decision.
There was a fairly frank discussion that the hospital district board had as to how can the hospital district board continue to fund projects for Unity where you can no longer distinguish between the 2 hospitals, where Allina's blended the finances, the actual operations, the babies going from Unity up to Mercy. How can the hospital district board take what's gotten to be an increasingly complex question of whether you can fund it and continue to do that? And in April of 2016, quite frankly, the hospital district board said, I think we can't do it anymore.
The hospital district has over the years contributed to capital projects at Unity, but its contributions are just a small part of the funding formula. According to Allina, in 2016, the contributions from the hospital district account for less than 10% of the total capital improvement budget.
We believe that the hospital board's role is its relevance to what we're doing and its role is diminishing and not something that is appropriate for the future. So we're supportive of the board's decision to dissolve.
Another layer to this debate is the looming election. 3 seats on the hospital district board are up for election, and a coordinated campaign called Save Our Hospital is being run by 3 community members seeking change.
Unity Hospital is a community hospital, and the community deserves a chance to speak. And now we have a little time that the community can help decide what will happen to our hospital and what can the public have to say about it.
Save Our Hospital campaign is really people just wanting to be assured that there's going to be the services that they need in the community. We very much are aligned with that. We look at the services that patients need, that the community needs most often. We're going to make sure we're there for our communities. And again, a busy emergency department, outpatient services, clinic services, and at times hospital care. We're going to make sure that we have those services in the community and in the market. And will they exactly be at that location, all of them? No, they aren't today. They won't be able to be in the future. No, really probably not. There aren't many hospitals that can be everything to everyone.
Yet another layer to this complicated debate is a lawsuit that has been filed by 5 concerned citizens to stop the hospital district board from executing a dissolution process. A hearing for a temporary injunction was held this week in Anoka County. The judge made no ruling at the hearing, but both sides were quick to claim victory.
Very happy with the results today. We went into court saying that they've been trying to dissolve it and saying that they're dissolving it. Today they said, well, we only intend to dissolve it. And we're happy about that they backed off on that.
The Save Our Hospital folks went in and they were looking for, I guess the simplistic term is a piece of paper that tells the hospital district, stop what you're doing. That didn't happen. It's clear from the judge's view, his questioning, that that's not going to happen.
In the lease, there is a stipulation that allows Allina to purchase the property from the hospital district for $1 if there is no outstanding debt. With the last bond debt having been paid off in 2013, Allina has indicated their intention to execute that clause in the lease agreement. Hatch and his clients believe that further negotiations are warranted.
Keep in mind there's a lot of surplus property around Unity Hospital that the district owns. It's pretty difficult to run a hospital with very limited parking, for instance, and that's what would happen. So the board does have leverage. There's also issues with regard to the lease I raised. I'm not making any conclusion about that now. But you can negotiate. The district ought to be representing the taxpayers. It ought to be getting the best deal in terms of the general health and welfare for the people, and not simply turn it over for a buck.
The hospital district board sees their role coming to an end and have decided not to levy any taxes for 2017. The election will determine the makeup of the board as it makes further decisions regarding dissolving. And in the meantime, the lawsuit will proceed. But nothing will stop Allina from implementing its plan for the North Metro region, with one hospital operating on 2 campuses.
The Unity campus is a strong community asset. We have a very busy emergency department there. We have med-surg services, surgical services. A lot of the basic outpatient services are there. We see those being there as long as the community demand and need is there for us to have them. We do recognize we have a lot of overlap between these 2 hospitals in our markets. The community really needs to be considered as the broader North Metro community versus any one individual campus, and that is our focus.
For North Metro TV, Ben Hale reporting.
We have information on our website about all the hospital district candidates and a detailed Q&A produced by Allina about their relationship with the district. Head to northmetrotv.com for complete coverage.